These memories that turn into PTSD experiences remain vividly entrenched in the brain. They have a hyper-intense memory of exactly what happened. So why don't we just overdose everybody on anesthesia to ensure that they don't remember anything ever, so that we don't begin to break their mind in the process of saving their body? Can any amount of political dollars prevent us from over-medicating patients in the wrong clinical context? Body and mind, boom, related. Hi, I'm Dr. Kave. I'm at the San Francisco General Hospital, now called the Zuckerberg General Hospital, where about 4,000 traumas come in every year. But are we just fixing the body and breaking the mind in these trauma surgeries? Years ago, I had a patient who had serious stabbing injuries, and they had to come here. They were treated perfectly well. All their organ function returned to normal, their physical wounds all healed. And they came to the operating room with me years later for an unrelated surgery. But I could tell from the monitors and the anesthesia that they had serious complications from PTSD, even though the incident had happened years ago. Why did that patient's mind get broken by the trauma, even though their physical body was perfectly well healed? It's because the mind-body connection is so powerful that physical traumas clearly can affect your mental health, and mental health traumas also come out in your physical health the way that I see in the operating room every day. Behind me is the ambulance bay, where trauma patients come in by ambulance to the emergency department, and they may go to surgery after that if they need for their trauma injuries. What happens back there is incredible. It saves lives, no questions about it. But really quickly, after we address the physical wounds to make sure that patients aren't bleeding out and they're not having catastrophic brain injuries, we need to make sure that we're addressing the mental health so that we don't begin to break their mind in the process of saving their body. And that process starts earlier than you might think. Anywhere from 10 to 60% of patients will develop PTSD from the ICU alone, either from breathing tubes, ventilators, needles, or even having anesthesia awareness or being awake for a trauma surgery. Why does this happen to your body, and how can you prevent it? There are 3 parts to understanding the mind-body connection in physical traumas that lead to PTSD. The first is that stressors and traumas happen to our body all the time, but they don't always lead to PTSD. For example, more patients than we think probably have some level of awareness under anesthesia, meaning they can hear or feel or see something going on in the operating room when they're supposed to be unconscious. But the majority of those patients probably never develop PTSD, even though they had a traumatizing situation. We see the same thing in veterans, where many soldiers experience traumatic situations, but not all of them develop PTSD. One of the big differences between patients who develop PTSD after a traumatic episode is that before, during, and after the traumatic experience, they don't have the same support system to help them be resilient to the trauma that they experienced. Not having that support system causes some changes in the brain that prevent that experience from turning into a normal memory from the past. Patients who have PTSD don't just have some bland memory of it, they have a hyper-intense memory of exactly what happened, like the music that was being played, the conversations that were being had, exactly what the temperature of the instruments were on their skin, and so on. All your senses are being activated by that traumatic experience when you relive it in that PTSD scenario. When you don't have a support system around you before, during, and after that traumatic experience, your brain can't consolidate that memory to make it like all the other memories you've had for the rest of your life. There are certainly other factors that will determine what experiences will turn into PTSD, but having a support system is critical. In the operating room, I see it in patients that don't have trust in their care team, also the patients who don't have a support system back at home to help them recover after the surgery from the pain, from not being able to move around or cook for themselves, etc. And they probably didn't have a support system in place prior to the accident that led them to coming into the operating room in the first place. And that's one reason why I call my patients the night before surgery, so they get to know who I am. It's much easier to trust somebody who you've met a day or two before your surgery, knowing that you're going to put your life in their hands in such a scary experience. That trust is one of the many support systems that I want my patients to have before, during, and after their surgeries. The same thing happens in the intensive care unit or the ICU, where patients have tubes and lines and IVs and all these other gizmos and gadgets connected to their bodies. That 10 to 60% rate of PTSD after being in the ICU is absolutely heartbreaking, because we spent so much time and energy to fix the physical body just to break the mind and the mental health. Number 2 is that there are many medications that we give in the operating room and in the intensive care unit that can also exacerbate delirium, which may contribute to PTSD in the future. A lot of those medications are the benzodiazepines like Xanax or midazolam or Versed, the anesthesia gases, the pain medications like fentanyl or Dilaudid. Pretty much any medication we give to turn parts of your brain off also appear to turn off the parts of your brain that protect you from developing PTSD from certain experiences. I'm not saying to not use these medications, but they need to be used safely in the context of a care team that you trust and who is supporting you. And it's not just your doctors and nurses, but even your family members and friends. These all constitute your support network that helps build your resilience against traumas in these challenging times. And number 3, one of the biggest fears that my patients have is being awake in a traumatic situation, like in the emergency department after a big car accident or in the operating room for surgery. The brain works really mysteriously with anesthesia. There is a specific dose your brain needs to not remember things, but we can't always give you the right amount of anesthesia to meet that requirement of your brain. If your brain doesn't get enough medication to stop remembering things or to form new memories, you run the risk of potentially remembering bits and pieces of what happened to you in the operating room. So why don't we just overdose everybody on anesthesia to ensure that they don't remember anything ever? That's because anesthesia medications like propofol, the gases that come out of the ventilator behind me, all turn off all the nerves in your body, including your heart, and if we give too much of them, you'll never wake up. So the medical coma of anesthesia is something that we need to finely balance to make sure that you wake up at the end of your trauma. Certain things increase your anesthesia requirements, and certain things lessen your body's tolerance of anesthesia. If there's a mismatch, you run the risk of remembering things. So for example, the more drugs your brain has seen before, the higher your anesthesia needs. Drugs like marijuana and alcohol all increase your anesthesia requirements. So does red hair to a small extent for certain medications. Anxiety and the medications used to treat anxiety can also increase your anesthesia requirements. But the stronger your cardiovascular system is, like your heart health and your lung health, the more anesthesia you can tolerate. And that's when you run the lowest risk of remembering anything under anesthesia. However, in a trauma, often you've bled out and your heart is working overtime to keep up with the demands of your body to keep you alive. And your body simply can't tolerate high doses of anesthesia. The same thing can happen in labor and delivery if there's massive blood loss, like a placental abruption, uterine rupture, or other massive blood loss like during a cesarean section. In these cases, your body simply can't tolerate the full doses of anesthesia needed to wipe your memories clean.
But not everybody that comes through the ambulance bay behind me ends up developing PTSD from their trauma. There's a lot of factors that go into that, but it starts with the medications that are in your body as you're rolling in and the condition of your mental health before you ever even hit the emergency room. Major depression, severe anxiety, or even unresolved PTSD from the past can all influence future PTSD from the traumatic episodes that happen inside that emergency room and the operating room if you have to go there after.
And this is where mental health matters so much, even from physical traumas, because the mental health that you bring into that traumatic episode will influence the likelihood of traumatic memories turning into PTSD in the future. Body and mind, boom, related. And the flip side is also true, because now you know that the more anxiety you have, the more mental health burden you have, either from substance use disorder or medications to treat those mental health conditions, the higher your anesthesia requirements, because your physical body simply needs more anesthesia to prevent those memories from forming. Mental health matters, even in the emergency department and the operating room, because the mind and body are connected, and you have more power over your mental and physical health than you've probably ever been told.